Stepping up the battle against Ebola, President Obama asks for more than $6 billion to fund the fight in West Africa and to help prevent the spread here in the United States. But a Minnesota community has decided it can't wait. It has launched a do-it-yourself effort to stop Ebola.
Okay, so this is pretty much where I stayed in this room when I came back from Liberia. This was where I was staying for 21 days. This is the room.
Kulubu Panaku is a mother, a wife, and a nurse living in suburban Minneapolis. She's also a Liberian American who visited the Ebola-stricken country this summer, just as the deadly virus started to ravage her home country.
I saw death. Friends of mine who we grew up together, like a nurse that I knew very well in Bone County, where I was born and raised, died from Ebola, from providing care from Ebola patients. And all because she never had no protective equipment. This is the downstairs living room. So I had a whole place to myself.
To protect her family, Kulubu decided to self-quarantine upon her return to Minnesota. For 21 days, she avoided all physical contact.
Self-quarantine was very difficult for the fact that I could not touch my loved ones. But I understood that that's the only way, if I had anything, not to spread it.
Kulubu's not the only one taking things into her own hands. She's part of a homegrown self-policing group in the town of Brooklyn Park, the largest Liberian community outside of Liberia. It's called the Minnesota Task Force Against Ebola, and it's a one-of-a-kind response to Ebola, organized by Liberians soon after the first case was diagnosed in Africa.
People felt that, look, if you want attention, you can work on your own. If you want impact, you can work together.
Abdullah Kiatamba is chair of the task force. Once a week, they gather at the Brooklyn Park City Hall. There are committees on grief counseling for those who've lost loved ones to Ebola, and committees to communicate with those outside their community.
We are people, not virus. We are person, not virus. We are your neighbors, we are not virus. We are your co-workers, we are not virus. So we want to make sure that sticks because there's a lot of misinformation about what the virus really is, even in America.
There are also representatives from Minnesota's Department of Health who serve as their direct link to the Centers for Disease Control and Prevention.
CDC announced yesterday that everybody returning from those three countries, Liberia, Sierra Leone, and Guinea, would go through the five airports.
The group invited local citizens from Sierra Leone and Guinea, the first time these groups have worked together.
And so it's been inspiring to see different leaders, different groups, organizations that are competing with each other are now working together. Different folks from different countries who never sat in the same room to discuss anything are now working together.
The Brooklyn Park fire chief also joined the effort.
And where the world might look to this population to be the most panicked, what the world is seeing is the most calm. The virus hasn't made it to Brooklyn Park, but the fear arrived several months ago. The minute the first case was reported in Liberia, we had a community that was struck with fear, and we set out from the very beginning to respond to that fear.
Chief Ken Prilliman is no stranger to Liberia's culture or its people. He's made several visits to the country. His first was in early 2012.
This is the current fire truck.
He discovered that Liberia, roughly the size of Ohio, only had one fire engine to protect some 4 million people. The chief and his squad have since donated equipment, a fire engine, and an ambulance to the West African nation. They've also trained the locals in how to use the donated fire engine.
If you hit this,
To put the power on.
power it on,
Yeah.
and then tone starts it.
But the chief says the teaching went both ways, as he learned important clues about Liberian culture.
We're working to identify all the various little cultural differences just in terms of providing routine service across the various cultures. Which culture can I look a female in the eye? Which cultures can I take a female's blood pressure without insulting her or her husband? And the list goes on and on. And so our PPE selection includes 2 different masks, one for the patient, one for us.
Over the summer, Chief Perliman put into effect a policy under which firefighters and police officers will wear eye shields and face masks, as well as gloves, when responding to calls involving flu-like symptoms, a practice just recently put in place in other American cities.
We should have in all the bags the suit if we needed to go to that level.
First responders have also been asking all patients with flu-like symptoms about any foreign travel.
A first responder who gets off this truck knows what to do to protect himself or herself while providing the best level of care for someone who's sick, regardless of whether it's Ebola or some other virus.
The task force is preparing for what's described as the worst-case scenario, a case among one of their own. After the 2 nurses in Texas were infected and CDC guidelines were challenged by some as lax, efforts here took on even more urgency, fighting not only the disease, but the fear. It's why the task force has a clear message.
We are part of the solution, not the problem. We are your neighbors. We are your friends. We are your co-workers. We are interested in making sure you're not exposed to this problem as much as we are.
Kulubu is planning a trip back to Liberia very soon. She wants to use her skills as a nurse to help Ebola patients and prevent the death toll in her native Liberia from rising even higher.
The best place that I can really make an impact would be Liberia, because they need me the most. They don't have enough healthcare worker or trained healthcare worker to provide the care that needed to be given to the people over there.
Her family is worried about her safety. Her daughter and mother have asked her not to go.
And I understand it's hard, but somebody got to do it. We can't all sit here and just see people die on the TV, and the news, it keeps going up, and then we just ignore it. Somebody got to do it.
Right now, Kulubu says her home country needs her more. Kulubu Panaku intends to be prepared when she does go back to Liberia. She plans to get training from the CDC on how to treat Ebola patients.